Hello and welcome to Sensei podcast. This is Manos Brilakis discussing with leaders in the field of CTO and complex PCI. Sensei means teacher or master in Japanese. The goal of the Sensei podcast is to help you learn and improve in CTO and complex PCI so that you can become the best that you can be and offer your patients the best possible results. Hello and welcome to Sensei podcast. This is Manos Brilakis, and it is my great pleasure to introduce our guest today, who is Dr. Ignacio Amat Santos, the director of the Cath Lab at the University Hospital in Valladolid in Spain. A great friend, great CTO and complex operator, actually structural operator as well. And it's a delight to talk to you today. Thanks so much, Ignacio, for coming to the podcast.
It's a great pleasure and very exciting to go with you into this adventure.
Wonderful. So Ignacio, I obviously visited you recently and I was very impressed with your Cath Lab. You've built a great program in multiple areas, a lot of didactics. Your fellows and your faculty were phenomenal. So tell me, how did this all happen for you? What was your journey? How did you learn these procedures, both coronary and structural for that matter? And how did you build the program?
Initially I was trained here in Valladolid, but at some point I felt I had to learn from somebody else. The team was really good here, but I could not do anything better than them because I learned from them. So I decided to move to do a fellowship, and I went to Canada, to Quebec. I was already trained in coronary cases, not very complex, not CTOs. But I went there mainly to train in structural with Dr. Josep Rodescabo. But then I met Stefan Rinfret, and of course, as interventional cardiologist, seeing him work, I said, this is something I want to learn. And I found my way negotiating with Dr. Rodescabo to spend some days every month with Stefan.
Wonderful, wonderful. So you learned for some of the best, both in the structural and the coronary world. So this explains a lot, but also shows your initiative, right? Because as you said, it wasn't easy since you were there for a structural fellowship to do the coronary work. So how did you negotiate? How did you convince them to let you learn all this? Were they saying, well, maybe it's too much for you, you should just focus on this? How did you negotiate all this?
Oh, the thing is, nowadays we are living a trend to choose. You have to choose the structural or the coronary. You cannot be expert in both. And at certain point, I can understand that. But also, I think you can try to struggle being very good in both fields, and this is what I'm trying. So I provide several arguments. I said, okay, I'm going to focus my research in structural, but I want to build a CTO program back in Spain. There is not so many people doing it. So for my country, it's important to bring this kind of program, blah, 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 blah. I just sold it in the best way I could. And actually, my plan was to do also research in CTOs, not only in structural. But first, I needed to learn. And of course, it was not only with Stefan. After that, I realized I have to learn from very different operators because this is a very variable field, and this is what I tried afterwards. I learned from my former boss, Federico Jimeno. I learned with Luis Teruel, who is a proctor here in Spain, with Julian Strange. So I built step by step the different skills, but starting, of course, with all the knowledge led by Stefan.
And what did you find the most difficult thing to learn in the coronary world, in the CTO procedures?
I think I have to remove some of the knowledge that I already had. Sometimes we learn from very skilled teams, but there are things that they are not doing very well. So I have some mistaken concepts, and I found very difficult to remove these concepts and settle a new basis to start building the program. Like, I don't know, the injection through the microcatheter, you cannot inject distally if you are not sure where you are. So now we start with Carlino and other techniques, but at that point, that was something that a lot of people was doing. Even now, some people are still, I don't know where my micro is, I will inject. So these kind of things you need to remove. And when someone tells you, this is wrong, you say, well, this is wrong. It depends. I have learned to do it safely. No. So being self-critical and also critical with some of your mentors is something that is important, and we need to maintain along our career, I think.
Perfect. And then what motivated you, right? I mean, clearly you had and you have a lot of motivation to be able to learn on this and implement it. So, what was the driving force behind all this? How did you get your motivation?
Well, I want to be the best version of myself, and professionally and personally, and of course, we fail and fail and fail because we we are never the best version of ourselves. This is the way we choose. And professionally, uh, what motivated me was becoming a very, very good operator, to feel that I was doing as much as I could to be the best, and then train other people so that this influence that I have received in Canada and from other places could be spread also in my setting to improve globally the healthcare of the patients where I was born in my region.
Wonderful. And then, obviously, you've done a lot of work and you built a great program. How were you able to build, in Valladolid, before you started the program, there was no CTO program, right? So, how were you able to start this program, and what were some of the difficulties you encountered, and how were you able to overcome them?
Well, so I came back in 2013 to one of the highest volume centers in Spain. That's already a problem because you find a place that consider that is doing things quite well. So you have to convince that there is something that we are not doing so well and we need to improve. We did not have any microcatheter at the time, no dedicated CTO wires. The cross-seat wire was the only stiff wire that was available in our setting. So I proposed to start doing some not so complex cases. I invited some colleagues. That was key. Inviting some colleagues who are also very diplomatic and can help you dealing with convincing your colleagues. And I remember in the first cases, well, the most common comment I could hear was, well, it's very interesting, but it's probably not useful for the patient. But that was the most common. Until one day I was able to perform the first retrograde case alone, no proctor, and then I could see my colleagues outside seeing the skills that were required for achieving that, and the team started applauding. And that was a key point in the program. So when your colleagues show you their respect for what you do, is the time to start building the strong project. But first you need to convince them to this first step.
Perfect. So, as you say, a lot of convincing to do, and that's true actually even today to many of the centers. People are not always necessarily big believers in this procedure, and there's obviously some risk involved. Um, how were you able to get your skills to improve to be to the great level you have them right now? You had obviously Stefan, Rinfre help you out in the beginning, some proctors, and then was it cases? Was it reading? Was it watching? How did you actually learn to do all these cases and be so fast and efficient? Because I've seen you operate, and you are very good at moving quickly from
Thank
from approach to approach.
Thank you so much. Yes. Thank you so much for sharing this because hearing this from you is wow, impressive. But first, I studied.
Yeah.
We need to study. We are now discussing the need for a dedicated exam in Europe that is compulsory for interventional cardiologists. We are not technicians. We need the knowledge, so we need to study. I tried to go to as many CTO meetings as I could, but honestly, I found life cases sometimes difficult to follow. Maybe it's me that I cannot concentrate enough and of course bring in proctors. But finally, the best way I have found to learn is what we did with you recently by inviting you as a big expert, but also performing cases and trying to explain it to other colleagues. When you have to explain something, you really need to understand that. And having this close collaboration with the big expert is the best way for me to learn that we can find nowadays.
Yeah, and obviously you've done a great job organizing this and very interactive as well. How did this idea come for doing the course in the first place? Was it something you always wanted to do? Someone told me. How did this start?
Oh, when I try to do education in our profession, what I think is, what do I need? Because I don't bring an expert just to teach my colleagues in a meeting. I want to learn something. And I don't want someone giving me a long presentation on how good their cases are, because probably they are, but I want to see real life work. I want to see how they are dealing with complications that maybe are never shown in the meetings because some small complications with the radial or with other issues might not be shown in a CTO meeting. And this is also very important for the outcomes. So when I tried to settle this CTO Val Academy in my center, the idea was I want to bring here something where I keep on learning from the expert, but also from the attendees. So we have to build the confidence to tell things, I don't understand why you are doing this, or I don't agree with the approach that you follow.
Wonderful. Wonderful. And then coming back to the way you do the cases. So obviously you have a heavy case volume, very busy cath lab, and these are complex cases. And many people have the same issue where they have a very busy lab, and then sometimes there are time issues, cath lab issues. How were you able to overcome that and have a great volume in multiple areas of intervention?
Well, I don't have the big solution for this problem. In the beginning, I tried to have 2 cases per week, sorry, on Fridays, always on Fridays, where there are usually less cases, but it was always very challenging. Quite often I have to cancel the second case. So now what I try to do is having 1 case, but several days per week instead of 2 cases, but also stratifying by complexity. Now I'm able to understand better the complexity. When I started, sometimes I underestimated or I overestimated more the complexity. So it was more difficult to program the timing for those cases. But now I think I'm better at that. I have some help from my colleagues also, and we can program 2 cases when we think it's going to be okay. We also have one more candle. We have 3 candles in the center, so that made things easier. But I think it's important to program according to the degree of complexity and then learn how to classify that complexity.
Wonderful. And then how do you deal with the complications and the failed cases? So this is always obviously tough on the person as well as the program. How do you deal with this, which inevitably happen in every program?
So technically, I try to be very cold-minded. So don't start shouting, don't get nervous. If everybody is starting to run and shout, just tell everybody, calm down, let's do this, this, and this. So I think it's important to transmit that to the team, but it's also important to train the team. The Val Academy is something that we did oriented for physicians, but has shown an incredible impact on our nurses because they are much more efficient. They work, they anticipate a lot. Anticipation is key in the cath lab, but not only from our side, but also from the nurses. So you need to train your nurses. Sometimes it's difficult because there is a lot of change in personnel in the cath labs, but the senior ones have to teach the younger ones. So this kind of internal workshops are also necessary within your team. And then just professionally keeping your mind cold, have your algorithms very clear. And well, after the case, you can get angry, you can shout, but not during the case.
Okay, perfect. Do you ever feel stressed or anxious during a procedure?
My secret is that I'm always stressed. I'm at a high level of stress. I try to fake calm, but it's difficult to deal with that. I think the main argument to try to calm down is that the worst thing for your patient is that you get nervous or anxious. So you owe to your patient to keep calm, to transmit that calmness to the team. And then once you're out, you can do your boxing or whatever you do.
Perfect. So, do you have any techniques? Do you take some deep breaths? Do you talk to people, or do you try? How do you calm yourself down when things are not going well and everyone is stressed out, as you say, everyone is running around? How do you calm yourself down? Is that something that comes naturally to you? Are there some things you do for that?
Well, I think naturally I take a deep breath. I always prepare everybody in the room. So if people is talking or walking in and out, I say, pay attention to me. Things are going to get messy. And then everybody knows that they need to keep attentive, keep silence. And when they react like that, it forces you to be also reacting like that. They are all attentive and in silence. You cannot be shouting and moving quickly. And so, but of course, the baseline training on the algorithms is crucial for keeping calm. When you don't know what to do is when you get stressed and you lost it.
Perfect. And then, how do you prepare for your cases? Do you have a specific tips and tricks? Do you spend a lot of time? How do you prepare for CTO and actually any case that you do, any complex case that you do?
So normally when there is a CTO case in my center and a colleague tell me, I have this case, maybe you want to consider this. I have the first look. This is my first contact with the case. And I already start building my algorithm and I discuss with one of our fellows who is focused on that. And I say, okay, let's keep this patient in our database. I think it might be a case for retrograde LAD approach, for example. And then we will watch again the case before programming it. Then we will watch it the day before the intervention, and then the day of the intervention. At the day of the intervention, we will draw it and especially prepare a list with all the devices that we might need for the nurses. So 3 or 4 times we see the case, and sometimes the approach is changing each one, but most commonly you keep selecting better your approach, your step A, B, C, and D.
Wonderful. And then do you have a cart with all your equipment that you put in the room, or you just bring the equipment inside the room that you think you may need during a specific case?
So in our CAD labs, it's a little bit special because we have all the balloons and everything outside the CAD lab. This was a requirement for the sterility. Don't understand why, but this was a requirement. And I said, for CTO, I cannot keep waiting. And I demonstrated this to the nurses. I asked during a CTO for a wire, for a balloon, and I put the chrono on every time I asked for materials, and it was more than 30 minutes waiting for devices. So we all agreed. Well, I imposed a little bit this, but we all agreed that the cart was necessary. So I have the dedicated wires, the microcatheters, the guiding extensions, and the 7 and 8 French guiding catheters all in one of the labs.
Perfect. And that, as you say, that makes a lot of much easier and saves a lot of time from everyone during the case. And actually, I think makes it more likely to succeed because, end of the day, you have to try different things, and the more time you have to try them versus waiting for equipment, the more likely you are to be successful.
Absolutely, and they have
but let's talk
check,
about your.
Yeah, and they have to check the CTO card as they check the CPR card. So somebody is responsible for that. So if you spend 3 Gaias, they have to use put in the chart in the card new wires.
I love this. It's the same as the CPR card. It's that important. Yeah. I agree. I'm going to use this analogy for other meetings, but you're absolutely right. The worst thing you want is in the middle of a complex case, you don't have the equipment, people are running around to find it. So that's perfect. But switching a little bit to the teaching part. Again, you've been a phenomenal teacher. I've seen you do the live cases. How useful do you find the live cases for the teaching? You mentioned sometimes the live cases can be a little long, can be a little tricky. You can lose focus. You may not learn. So what is your thought about live cases and as a teaching tool, and how do you function when you do live cases as an operator?
Oh, I know people tend to lose focus, especially in long cases. So I think one of the responsibilities of the operator or the second operator, probably best the second operator, is to summarize the case several times during the case, what we did until now, because otherwise you lose people. Then if you have some small tips and tricks that you consider is obvious and everybody knows it, just share it. Spend 10 seconds explaining, I'm doing this because of this. Because there is always someone in the audience that will learn that trick. So this is also very important. And if you are having issues, don't be shy or don't try to hide your complications or your mistakes. Well, I was trying to remove the micro and I removed everything. Why this happened to me? I was working with 7 friends, but I had 3 wires. Because this is something that is also very educative. But I mean, we are doing our best. Sometimes we make mistakes. In live cases, this also happens, and is the greatest value of the live cases. Nobody's going to show in a recorded cases how to remove the wire involuntarily. So you have to show these things in live cases, and don't be ashamed.
Yeah, absolutely, and you're right. I mean, there's nothing. The worst thing is trying to hide it because you cannot hide it. I mean, as you say, people see exactly what's going on. So, and I think that's probably the biggest value of the live cases. You see live troubleshooting, how people respond to different scenarios. Because as you say, you can always look out the algorithm and say, okay, you do step A, 1B. one, two, three. But if you're in the real case, it's different to see how people actually use those algorithms and how fast they switch and how appropriate they make those changes as well. Um, when it comes to the teaching, I loved when I was in your lab that you have the drawing screen, the monitor with the drawing. You draw on the monitor, discuss about the case. What do you find the most difficult thing to teach people when it comes to CTO and complex PCI?
Well, the most difficult thing to teach is the thing that you know works. I mean, if you are not very good at reverse card, it's very difficult to let your fellow or one of your colleagues doing it. You can explain the theory, but if you are really always dealing with the same problem, this is something that you hardly can teach. And if this is happening to you, you need to bring someone to your place so that they teach to you and your team. And you have to recognize to your team, well, I'm not good at this. We need someone who is really good at ADR. If you need to do ADR, then you will need to do it many, many times before you are able to teach it. And in the meantime, you need someone doing it with you.
Perfect. Perfect. And then when you choose the people you train, when you select your fellows, your complex fellows or regular fellows, what are you looking for in the people who are applying for these positions?
Well, I'm very exigent as I'm to myself, and I just need passion. There is some people who is more skilled than others by nature, but I think in most cases this can be overcome just by training and being devoted. So for me, passion and dedication and understanding that the final end is to improve in the patient's life. This is really important. I understand the ambition as the ambition to improve, but for someone else, not ambition as a final end.
Wonderful. And then when you show cases and you do cases, how many cases do you think it takes for an operator to become good at CTO or CTO PCI?
So again, there's different kind of people. For some people, it's easier. I think maintaining between 30 and 50 CTO cases per year, especially when you are starting, is crucial to have a constant level. So for a fellow, for example, they should be exposed to a high number of cases, at least 100 during their training per year. But once they are over that stage, they should try to maintain between 30 and 50 cases, maybe initially not the most complex ones, but they need to keep exposed to this volume of CTOs from my perspective.
Okay, wonderful. So you clearly have many things on your plate, doing a lot of things in clinical research education. How do you keep fit for all this? How do you keep yourself in good shape and motivated and able to handle all the pressures on time and energy and um, the ability to teach and do things?
You mean how don't we go crazy, right? So for me,
Yes.
it's important to have some activities outside the work, even if we are a little bit workaholics. I do a lot of sport. For me, that's very helpful. Then what I call family quality time, which means a short time, but it has to be very intense, is also very important. And well, basically, is that you are able to keep a small time for you and the people you love, and this will keep you fighting every day. There are days and weeks that we are way too busy, but then we should be able to compensate this with weeks where the pressure goes down a little bit.
And how old are your children?
No, I don't have children. I don't have children.
No
I'm
children.
married,
Okay.
but no
So
children.
no children. So perfect. So you have more time to spend, I guess, before children come through.
I think that's my
And
secret,
which sport
probably.
do you do? And I know you're doing some CrossFit. I mean, what do you do for exercise? I know you're very, very much in very good shape, which helps a lot.
Well, I used to swim a lot, almost every day. Now, not so much from time to time, but I do CrossFit, as you said, as many times in a week as I can. When I'm not in my hospital or I'm traveling, I try to keep training every morning, uh, which is not easy. And always when I travel, I make some room in the suitcase for some sport clothes. Just go out running, even if it's 10 minutes. Visit the city you are in the Congress or proctoring or whatever. In that way, I think it's a great way to know a place and keep you in good shape.
Wonderful. How? What is your favorite movie or your favorite book?
My favorite movie is Gattaca. I don't know if you know this film.
I don't.
Okay, I recommend this one for you. This is the Ethan Hawke, and well, this is a film where people is genetically selected to be best, and there are children who are selected and children who are not, and those who are selected have access to the high level professions. But one of them wants to be an astronaut, and he is able to go through all this process, cheating everybody as if he were selected. And finally, well, I will let you see the film, but I think it's very important that if you want to, even if you don't have the nature on your side, you are able to do it. That is why I like this film. And the book I
Perfect.
love,
So,
yeah, I love a lot of books, but just on the other side of this Gattaca film, a book that I read recently was Number Two. And number two is about the person who went through the casting for Harry Potter and was not selected in the final casting. So he was number two. And how he dealt with all that frustration. This book was really helpful for me because I tend to get frustrated very easily. So I think it's very important to know how to deal with failure.
wonderful. That applies to everything, as you said. Now, you do a lot of research on multiple areas. What are the things that are you're most excited about right now?
Well, I'm investigating in structural and in coronary cases. In the field of structural, I'm trying to make a big step in the treatment of patients with mechanical valves so that we can deal with any complication that can occur through transcatheter techniques. And we are doing some animal experimentation, and that is wonderful, super interesting, and can help a good number of patients. And in the coronary field, we are mainly working in vascular repair techniques. So bioresorbable scaffolds, DCBs, but also this in the field of CTOs, of course. So we are trying to find a durable solution for coronary disease.
And then how does that cross feed or apply to the clinical work? Like the research you do on both sides, on the coronary and the structural, do you think it helps you on the clinical side? And if yes, how so?
For some time, I have the complex that I was not a true researcher because I'm not in a lab with, so seeing the cells on the microscope. But then I realized that the investigation needs people like us who are in the field, who are seeing patients, and who are making the clinical questions. I do a wonderful CTO, and the patient comes back 1 year later, and the CTO is occluded again. So something is wrong. I have not done the right thing. So we need to investigate that. This is why I'm focusing on repairing the vessel instead of just stenting everything. And same thing for a structural field. We have sometimes even small questions that are not answered yet, and we need to keep working on these small clinical unanswered questions to improve the patient's outcomes.
Wonderful. How many hours do you sleep?
Normally about 6 hours, unless I'm on call. But if I'm not on call, about 6 hours.
Wow. And are you feeling in good shape and energy? I mean, obviously you are doing all these things in a high level. So, but are you feeling good shape? That's all you need, or you think that you could use more?
I feel tired most of the time, but I think I'm used to this sensation. Um, I think probably we lost way too much energy on things that we shouldn't, like administrative job. I have to prepare the tenders for the hospital, these kind of things that probably, well, yes, it's us who are using the devices, but I think this should be done by someone else and keep us focused on, well, the research and the clinical field. but it's the pay to price, the price to pay. Sorry.
Yeah, absolutely, absolutely. And then, what are you most excited about right now? From the many things that you are doing, what are the things that you're most excited about?
Well, I think I've been the director of this cat lab for about 4 years, and now I want to make like a big qualitative change in our workflow. I want to have a CT in place. I think we should not do any more coronary angiography. We should do a coronary CT to all patients and just go and treat what is necessary to be treated. So I'm trying to change all the workflow, both for structural and coronary, to speed it up and to simplify, especially for the patients. But it's not being easy. The logistics are a great challenge. This is why I like.
Absolutely. So, um, this is perfect. Well, that's the area, and obviously CT is growing quite a bit. How often do you use coronary CT for planning your cases, either CTOs or otherwise, right now?
Not very often. For structural, yes, but for coronary, we have limitation of spots, and this is why we are not using it more.
Sure. But absolutely, I think time will come, as you said, that we will be planning our complex, and we already do that for many cases. The complex cases, we're planning them based on coronary CT more so than based on the angiogram alone. So it's going to be a lot of synergy, and it's an exciting time to be coming forward.
For sure.
What are the things that you are most proud of? Again, you've done so many things already, both clinically, research, education. What are the things that you are most proud of so far?
So I think I was able to create a change in mindset here so that every patient is an opportunity for research and for improving the outcomes of other patients. So every time a patient goes in our cath lab, he goes through a screening process to see if he's candidate for any trial, any ongoing study. And if not, we wonder why we are not studying to improve what we are doing to this patient. So this is in terms of logistics, is the mindset of all the team, and this is important. And now my main motivation now in research is this project that I mentioned about the mechanical processes, because I think this can be a big change in our practice.
Wonderful, wonderful. And then, how long are you planning to practice until you are 80 years old? What are your plans long term?
It's difficult to say this while I'm being recorded because I know everybody says I'm going to retire when my time comes at 65 or 70, and then everybody tries to push this. I think because people feel it's good and they are at the point where, I don't know, I have the power, they have the skills, the knowledge, and I understand that it's difficult to leave it. But honestly, one colleague here in Spain told me that we need to keep fighting to be the best version of ourselves. And once you reach that point, this could be at your 40s or your 50s, but from then you are not going to be any longer the best version of yourself, professionally, I mean, which means that you can be still good, but not the best version of yourself. So what I want is to keep for the next 10 years or so, trying to become the best version of myself. And once I feel I have reached that spot and I start to decrease, I want to keep on working, but more leading others to be the best version of themselves, to improve the logistics, to do more research, and maybe less practice from my, I don't know, 50, 55. Keep on working, but from a different perspective. And retiring, I don't know. I would like to enjoy my life after this stage. So I don't want to retire when I cannot walk and I feel bad. So maybe 70, I don't.
There you go. Well, clearly, a long time until then, and but it's you obviously have so much energy and enthusiasm and creativity that these are too premature thoughts. But it's always good to think about these things down the line. Now, when if you had to advise the young generation, new people who come work with you or with other people, and they want to become great operators, coronary or structural or both, what would be your advice? What are the key things they should do so that they are most successful in their quest to become the better version of themselves, as you said?
I would advise not to look for excuses not to do it, because my girlfriend is here and I don't want to move so far away. Convince her to go with you. find her also a professional challenge. So move with your family, do whatever you need to move with who you consider is the best to teach you at that point, and do not be afraid to make the step at the right time. You can always go somewhere else to learn, but there is a time in your career which is the key time, and you should not force yourself to find excuses not to do it.
Perfect. So no excuses, but try hard, and that's how you get results. Perfect. Well, Ignacio, thank you so much. Again, that was wonderful talking to you today. Thanks again for sharing your insights on learning and becoming better every day. Congratulations on your course, on the ongoing research, and looking forward to continue working with you on multiple fronts.
Thank you so much, Manos. A pleasure.
Thank you for listening to the Sensei podcast.